Hello, thanks very much for joining me in this webinar on future strategies for Ovine Johnes disease. The objective of this talk is to present how the landscape for managing Johnes disease in Queensland is changing in the near future to enable producers to better manage their, identify their own priorities and manage accordingly. Producers will need to understand what tools are available and how to use them into the future. This talk is one of three in a series. The first part is a general introduction to OJD so that you can understand the background. Parts 2 and 3 will provide further information about more specific management of Johnes disease in Queensland. Ovine Johnes disease is caused by infection of the gut of animals with Mycobacterium avium paratuberculosis. That's a bacteria. There are several known strains of Mycobacterium avium paratuberculosis in Australia. The strain which most commonly affects sheep in Australia is S or sheep or ovine strain. There's cattle strain and bison strain as well, but they are minor when we're talking about Johnes disease in sheep. The disease itself is not caused directly by the presence of the bacteria, but rather by the animal's immune response to infection. On the picture in front of you shows a normal sheep gut and the thickened gut of an infected animal. That thickening and corrugation of the lining of the intestine is due to the animal's immune response. One of the features of Mycobacterium avium paratuberculosis is that it grows very slowly, and that has implications for the disease itself and for laboratory testing. This thickening of the gut reduces the ability of the gut to absorb nutrients, so animals which are infected towards the end stage of the disease anyway, have a voracious appetite, but still they suffer from wasting, ultimately leading to death. The progression of disease is most significant in animals which are subject to stress. So that occurs with high stocking rates, and particularly it occurs in lactating ewes. The infection spreads from infected animals in the feces, and new animals become infected through exposure to those feces and by ingesting the mycobacteria in food or water. There is some value in vaccination, especially for sheep, in reducing the progression of disease in infected animals, the amount of excretion of infection in the feces of infected animals, and spread of infection within herds and from infected herds. However, vaccination does not entirely prevent spread of disease. Testing is difficult for Johnes disease, particularly because of that slow development of the slow growth of the bug. It means that the animal's immune response is slow to develop, and it means that detection of disease only occurs late in the course of disease. So testing individual animals is a fairly unreliable thing to do. What testing does have value for, though, is testing flocks. So negative tests for a flock gives you assurance that the flock is low risk, and so animals coming from the flock are low risk animals. What we've been able to see over time is that where disease is essentially uncontrolled, as it was in Victoria in the early part of this decade, is that there's been a gradual increase in prevalence of infection. That contrasts with areas like Queensland and South Australia, where in effect over time disease prevalence has remained very, very low. So there are ways of there are means of controlling, or there is value in preventing the ingress of Johnes disease into these low prevalence areas, but those means of control are not as appropriate for an area where where Johnes disease is common. So we have good evidence from abattoir monitoring of low prevalence in Queensland, contrasting with Victoria and the central and southern highlands of New South Wales, where we've seen over time Johnes disease increasing prevalence and geographic distribution. In response to that, in Queensland, we retain a program, or we have retained a program to exclude disease from entering Queensland. That program would not be appropriate in those established areas. So the program in Queensland is targeted at reducing the risk of infection entering Queensland, or if it does enter Queensland, preventing its further spread. So the current regulations under the Stock Act are all about entry requirements, which are currently listed on our website. Basically, unless sheep are coming from a low risk area, then an MN1 status is required, and a regulatory response, that is quarantine movement restrictions, where disease is confirmed or suspected to occur, and we investigate and trace from there. There is further information coming in the next 2 webinar parts, and also on websites as shown on this slide. Thanks for listening.